Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Dr. Ashish Kabir, board-certified neurologist with Hamilton Physician Group-Neurology at Vitruvian Healthcare System. Dr. Kabir, thank you for being here.
Thank you. I'm really excited to be here.
So today we're going to talk about dementia and how it differs from Alzheimer's disease. Is there much difference there?
Yes, and I think that it's very, very important to make that distinction. I think people tend to use the terms Alzheimer's and dementia interchangeably, and I think that actually does a little bit of disservice to the patients suffering from memory problems or cognitive issues. The term dementia, I actually prefer the term cognitive impairment because it's a little bit more encompassing. It includes, not just memory problems. It can include personality changes. It can include behavioral changes, that sort of thing. What you want to do is find out why the patient has dementia or memory impairment and try to address that. So if you want to think of dementia as kind of the overarching term, Alzheimer's disease is one thing that causes dementia. Another thing that causes dementia or cognitive impairment is vitamin B12 deficiency. Completely different issue. We expect that if you treat vitamin B12 deficiency, you won't have dementia anymore, whereas for Alzheimer's, unfortunately, it's a little bit more complicated. So yeah, I think that's the first step in trying to find out why the patient has the symptoms that they're presenting with. And I think that, we shouldn't be afraid of the term and just say, they told me I have dementia. I understand the societal implications, but what this is to me is it's an opportunity to actually target what's going on with you. And I think oftentimes there are good solutions available. You just have to kind of label something and just say, okay, I'm going to get worked up for this. Does that make sense?
Yeah, that's definitely right. And just with all of these different things under dementia, could you tell us more about just the different types and how they actually work?
I think dementia or cognitive impairment as either reversible or not reversible, if you want to think of it that way. It's not entirely true. Many things that I would consider not reversible may actually be certainly controllable, if that makes sense. Okay. But long and short of it is that the reversible causes are when I'm thinking about things like vitamin deficiencies or autoimmune diseases or, for example, poisoning by heavy metals or something like that, all of which typically have something that we can do to try to reduce the effect of that. One thing I would put in this category is something called vascular dementia, which is basically what happens is as you get, especially if you have diseases like diabetes and hypertension, you can have a small stroke-like injury to the brain in the same way that you can have cholesterol build up in the heart or kidneys or something along those lines. And so if you have enough of that, what can happen is you can kill off the brain cells in your head and you can have memory problems or personality changes or basically dementia-type symptoms as a result of stroke. So I consider a lot of that reversible because if you control the diabetes and if you control the hypertension and if you control the cholesterol, you can definitely reduce the progression of vascular dementia. Contrast that with the, not reversible or what we call the primary dementias, which are Alzheimer's disease, Lewy body dementia, and frontotemporal dementia. In these diseases, what happens is the brain accumulates what we call, basically the brain accumulates abnormal protein. So in Alzheimer's, it just so happens that the protein that's accumulated comes from something called beta amyloid. These are just big words, but basically this protein eventually causes death of those brain cells. In Alzheimer's disease, this tends to happen in the areas responsible for memory, so Alzheimer's disease patients tend to present with memory problems. In Lewy body dementia, the protein is called alpha-synuclein. Again, let's not get hung up on the protein names, but long story short, the protein tends to accumulate in areas responsible for movement and may cause hallucinations, that sort of thing. And in frontotemporal dementia, tends to accumulate in the frontal and temporal areas, basically the front and the sides of the brain. And with this type of dementia, that particular protein causes changes in behavior, personality, and language. Honestly, a patient may have all of these symptoms, so it's very hard to distinguish which particular primary dementia a patient has. But with new technologies that I'll allude to in a little bit, really we have a ton of potential in, first of all, identifying what the real underlying problem is and figuring out what to do about it. So it does matter. Does that make sense?
Yeah, it does. And for some of the different types of dementia that you were talking about, are there instances where you can have it and memory loss isn't the main thing?
100%. In particular, frontotemporal dementia is the most common dementia in younger patients.
Okay.
So, you have a 50-something-year-old who comes in with memory problems, but also, quote, they've been acting odd, unquote, right? And, it's not like they're getting into trouble at work and all this other kind of stuff. Oftentimes, the underlying cause can be frontotemporal dementia, and this is definitely something that your neurologist will consider when trying to figure out what is causing this. There's certainly interventions that can help mitigate some of the symptoms of that, so early diagnosis and treatment is very important for all dementias.
Definitely. So some early signs to look out for. What can you tell people on that?
So honestly, I think anything that feels off to you is something that you should discuss. But specifically, I think memory, such as not just forgetfulness, but word finding difficulty is a common thing. Difficulty with tasks that used to be something patients were very familiar with is a red flag for me. Things like that. Difficulty with planning, organizing, language. Disorientation in familiar places is a big one for me. And then any personality, mood, behavior changes. If you're having hallucinations, seeing things that aren't there, or hearing voices, that's definitely something that I would speak to someone about. I know there's a lot of stigma and a lot of preconceived notions that people have about people who have these things happen to them. And patients tend to be very reluctant almost to kind of say, well, no, I don't want to talk about that. I get that a lot. But it's really, really very important to be very open with your physician and with your providers so that we can really have a proper picture of what's getting in the way. Because honestly, we likely have something that can help. And it may even be something that if you act early enough, we may not have to deal with the consequences of not acting early, such as more advanced medical care if you allow the disease to progress without bringing it up.
Yeah, and how do you go about actually diagnosing this?
Okay, so as we've mentioned, we've really come a long way in the kind of technology we have available to us in this process. So, the process starts with at home with family and caregivers identifying symptoms. If you're noticing that you're relying a lot more on certain technologies for things that should be very simple to you, make sure that it's something that you're doing intentionally. If it's not, then, bring it up. I think that's appropriate. Once you get to your primary care physician or provider's office, I think that's really where you want to be fully transparent with everything that's going on. They probably have the broadest knowledge base in terms of where, your symptoms might be coming from. So they'll typically do neuropsychiatric tests such as the mini mental status exam or the Montreal cognitive assessment test. Some of these are familiar to some of our patients, but basically what they do is they look for example, we may say that most of the population should be able to identify these animals that we have pictures of. And if you know it, but it won't come to you, that can be a red flag. So basically we use those to kind of help classify whether you have mild, moderate, or severe cognitive impairment. And based on that, we can order blood tests, imaging tests such as MRIs, CTs, and PET scans, and refer to specialists if appropriate. Then the patient typically goes to the neurology office. So at Hamilton Physician Group-Neurology, what we do is we go over the workup that your primary care provider has already done. We typically collaborate with them, and just stay in touch and say, yeah, I think that's great that you've done all this. Now it really looks like there may be something, that's quote unquote wrong with the brain per se right now, and we want to find out what. So then we will likely do what we call blood-based biomarkers. So these are basically blood tests that look for evidence of the bad proteins that cause the symptoms in the brain in the blood. So we can do that now. Before we had to do more lumbar punctures or spinal taps or more advanced techniques. Now a lot of this is available just with simple blood tests. And the other things that we'll do is we may do more advanced psychiatric testing that looks at specific areas, like, for example, if you're having trouble with depression, we might do a screening test for that. If you're having trouble with activities of daily living, we might do a separate screening test for that. But we'll also likely order imaging tests in the neurology office, and these are usually an MRI, which shows us sort of the structure of the brain, and also a test that's become very popular now called a PET scan. And what this test does is it's a scan that binds the specific abnormal protein that we think causes the symptoms of Alzheimer's disease. So, for example, in Alzheimer's, we think the bad protein, quote unquote, is something called beta amyloid. This PET scan binds specifically to the amyloid, and our radiologists and our diagnostic group can basically say, oh, look, this is present in the brain. That makes it very likely that this patient has Alzheimer's disease, for example. So some really fancy technologies to identify exactly what the underlying cause is. Of course, you can't just do a test and that be the end of it. You really do have to collaborate with caregivers, family members to see if this is really something that fits the disease or not, And so based on that, you can target your treatment and your recommendations for what to do next. For example, I'll use a sad example this time. If you've waited for a long time and the patient is having very significant difficulties living by themselves, or, even with the help of a caregiver, they're really not able to, prepare their food or dress or something like that. And then we do all of these tests and find out that really it was Alzheimer's disease. We know, but we may not be able to offer any treatments at this level. That being said, in terms of symptom control, we may be able to offer something. So, for example, if the patient is also having hallucinations, we certainly have medications that can help with that. If the patient is having falls, we may refer you to therapy. If the patient is having difficulty with a particular area, so for example, remembering how to warm up their breakfast or something like that, that is something that cognitive therapy or speech therapy can help with as well. So there's always things that we can likely help with. But it starts with the correct diagnosis, and so we put a lot of effort into using the latest FDA-approved techniques for diagnosing the conditions.
Yeah, I mean, you touched up on it a little bit, where there are treatments, right? There
are, and I think that's the real hope for our patients with cognitive impairment. For the primary dementias, Alzheimer's disease, frontotemporal dementia, Lewy body dementia, there are no cures per se, and by cures I mean a medication or a procedure that would really stop the disease once and for all. Currently, that doesn't exist. That being said, we are very, very good at mitigating what the patient actually suffers from. So if the problem is the accumulation of this abnormal protein that's causing the brain cell death, for years we've been able to provide medications that can kind of help compensate for that. Cholinesterase inhibitor medication, what it does is it basically helps keep acetylcholine, which is a neurotransmitter, we think that helps improve memory, around a little bit longer. And other medications which can help with focus. So we've had these medications for a long time. They're generic, easily available. Oftentimes they are now even prescribed by your primary care office because they don't want to wait for treatment and because it can be very helpful. Nowadays, though, we really have entered this new fascinating world of treatment where we can truly begin to target the core problem in particularly Alzheimer's disease. In Alzheimer's disease, the core problem is the accumulation of beta amyloid, which is a quote bad protein unquote that causes brain cell death. What we can do now is we've done this PET scan, right? That's identified that you have this abnormal protein. We have what are known as monoclonal antibodies, and the FDA has 2 monoclonal antibodies, both of which we offer at Hamilton Medical Center and the People's Cancer Institute as infusion therapies. And basically what happens is you come either every 2 weeks or once every month, you get this medication that removes the abnormal protein that we think causes the problem. So really getting to the heart of the disease, right? So this is the first time where we've really targeted, what we think the underlying problem is. Does it work? Yeah. We actually expect about a 30% difference in memory test scores at 18 months, which was the duration of the clinical trials that looked at patients who either got the drug or got what we call placebo, so basically not the drug. And patients that got the drug did about 30% better on those tests than patients who didn't get the drug. And what's interesting is after 18 months, what we call the open label extension, or basically the patients that continued to get the drug continue to do better over time. And so we're very excited to offer these treatments here at Hamilton Neurology and People's Cancer Institute. And we make sure that the patient is appropriate. There are some definite risks and side effects that have to be considered. Some of the side effects can be very serious, and so you really need to talk to someone who has a lot of experience. And I'm very proud to say that we have almost 50 patients that are currently receiving these therapies. The side effects occur with medications, but the more patients you have, the better you get at mitigating those side effects and identifying the risks for those side effects early on. If you have any questions about these, you really, really should reach out to your primary care physician and to your neurology group so that we can kind of help address those concerns and kind of give you, a full service answer, if you like, to what options you have for treatment at every stage of the disease.
If you or someone you know is concerned about memory changes, consider reaching out to Hamilton Physician Group-Neurology. Visit Vitruvian Healthcare System's website at vitruvianhealth.com or call their office at 706-275-6121.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.